In preparation for fat transfer, or lipostructure as I like to call it, we have patients follow some specific preoperative instructions. For about 5 days before, we have them avoid aspirin, Motrin, vitamin E, and other medications or things that can thin their blood. We also have them take an antibiotic beforehand and something called Mephyton, which is vitamin K, which helps prevent excessive bruising after the procedure. On the day of the procedure, they come in, we take some photos, of course, and then we take them to the room and prep the area. Basically, what we do is we find where they have some excessive fat. Typically, that's below the belly button, on the belly, and we numb up a little space right at the belly button, and that's a pinch. Through that little space, we're able to go under the skin and numb the fat. That's more pinchy than painful, and so once that area is numbed, we're able to remove fat. We call it harvesting fat. We use a small little cannula or tube and a syringe. I don't use vacuum syringe like they do in liposuction to remove the fat, because that can damage some of the cells. In all the years of doing fat transfers or micro lipo injection, we've learned how to baby the fat so that most of it survives. If you break those cells as you're removing them or replacing them, they won't survive. So the high vacuum removal of cells, I think, is a no-no. So we're very careful about just doing syringe removal. And we remove enough fat to do the job. We spin it down in a special centrifuge that doesn't break cells again, and transfer them into sterile syringes. At that point, I've already marked your face where you need the fat replaced, and we'll go and we'll put fat in under the eyes, or in this area, or along the jawline, sometimes even in the brow or forehead or temples. And by doing that, we're able to revolumize you and give you some fat back. And once that happens, we're able to give you some post-operative instructions and let you go home. That evening, you'll do some light, cool compresses. We don't like ice on the new fat. We don't want to slow the blood supply and have those cells die. And the next day, we have you come in and we look at you and make sure everything looks good. Typically, we have some swelling and sometimes some bruising. Probably 1 in 5 people will bruise. Most people don't bruise, though. 4 out of 5 do very well. And you'll have some swelling, but the people we're replacing fat on usually look good in the swelling because they need the volume. And so over the next 3 or 4 days, most of the swelling will start to go down. By the end of a week, the majority of the swelling is gone. There's still some there, but the majority is gone. And by the end of 90 days, we know how much fat is going to remain and how much will be lost due to the takeaway of the broken cells.